puts it all at risk. Because while President Biden and Vice President Harris are doing everything they can to protect and even strengthen the Affordable Care Act, we know that Donald Trump has promised to repeal this law with no serious plan to replace it or help the hundreds of millions of people who would be harmed. And we better take him at his word on this one, because when he was president, gutting the Affordable Care Act was one of the few promises that he actually tried to keep. Let's talk about what's on the line here if Donald Trump is elected president again. 4.2 million North Carolinians with pre-existing conditions, whether you're on the Affordable Care Act plan or not, could be denied health care coverage or forced to pay thousands of dollars more to get approved for insurance. More than 1 million North Carolinians now getting federal subsidies to help pay for their premiums would have to pay more for their coverage if they can even afford it at all. A middle class family could face $13,000 more in annual premiums. 5.5 million North Carolinians would no longer be guaranteed free cancer screenings, annual checkups, cholesterol tests, and other preventive care that saves a lot of money in the long run, as well as saving lives. And more than 2 million women in North Carolina would be at risk of losing their no-cost birth control. Preventive health care that we're taking for granted now could be gone in a flash because of just one election. Prescription drug costs will skyrocket for tens of millions of seniors if Donald Trump and his allies repeal President Biden's cap on prescription drug costs for seniors, including that $35 a month cap on insulin. And during this past enrollment season, North Carolina had about 1 million people get health insurance through the Affordable Care Act marketplace. If Trump wins, it could all be gone. And to top it off, the Affordable Care Act allowed for states to expand Medicaid, and North Carolina's expansion, as you well know, took effect on December the 1st of last year. And we're getting close, not there yet, but we're getting close to 400,000 people who've already signed up for coverage that took a decade to pass. Finally, we were able to bring enough Republicans on board to make it a reality. And I want to thank everybody up here for the hard work they've done, Representative Reeves in the legislature, Secretary Kinsley, and all of the advocates. It's been amazing. So many people who just signed up for Medicaid expansion and many people who are getting health care coverage for the first time in their adult life, that dream come true could turn into a nightmare if Trump wins. Let's be crystal clear here. Just as these North Carolinians are finally getting their health care, finally getting to visit a doctor regularly, taking control of their health care, Donald Trump would rip those health care coverage cards right out of their hands. And when it comes to things people care about, getting themselves and their loved ones treated when they're sick is at the top of the list. And even if you're 65 or over and on Medicare, you have a stake in this election yourself. Most of you have children or grandchildren who'd be hurt by this, and we can't forget that Republicans and Trump have talked about cutting Medicare itself. Joe Biden, as vice president under President Obama, was crucial in helping to negotiate and pass this Affordable Care Act 14 years ago. And he's still even more committed to lowering costs and expanding access to care and making the healthcare system work for everyday people, not big pharma, not the insurance companies. Joe Biden has helped drive the rate of uninsured people to a record low. And he's lowered prescription drug costs for 2.1 million North Carolina seniors and expanded access to mental health care, which is needed now more than ever. When he was president, Donald Trump came within one vote of repealing this monumentally important law. And he said on the campaign trail that he's going to do it again if he wins. We cannot let him anywhere near it. There are many stark differences between these two candidates. And when it comes to health care, that's where you see the best of Joe Biden and the worst of Donald Trump. I'd like to turn it over to the Democratic leader in the North Carolina House, Robert Reeves.
Thank you, Governor, and good morning, everyone. I'm House Minority Leader Robert Reeves, representing Chatham and Randolph counties in the House of Representatives. And I'm excited to be here to celebrate the 14th anniversary of the Affordable Care Act being signed into law. No one knows better than North Carolina how crucial the Affordable Care Act is to our health and our state. The ACA has helped make affordable health care accessible for millions of people across the country, including more than 1 million North Carolinians who rely on the ACA for their health care coverage. Folks in North Carolina have fought hard to get access to affordable care. Now more than 600,000 North Carolinians are able to access coverage through Medicaid expansion. And President Biden is keeping us on the right track. Under his administration, he has lowered prescription drug costs, saving families hundreds of dollars a month by lowering premiums. He is committed to protecting access to reproductive health care, fighting to protect and expand Medicare, and making sure mental health care is covered by insurers. But on the other side, Donald Trump is pushing an extreme agenda focused on repealing the ACA. That can't happen. North Carolinians know what it's like when extreme Republicans block affordable care. That's why health care is on the ballot once again this year in North Carolina. Because if Donald Trump is elected, more than 1 million North Carolinians could lose their health insurance, including many people with pre-existing conditions like cancer, diabetes, asthma, COVID, depression, even difficulties with pregnancy. I'm a proud parent of 2 exceptional people, and Donald Trump would put the care of these young adults at risk. Premiums could go up by hundreds of dollars a month for millions of North Carolinians, and seniors on Medicare could see the cost of their prescription drugs skyrocket. This is life or death for some people, and this is what is at stake in this election. Donald Trump has made it clear time and time again that he does not stand with working families, and he won't stand up for our health care. North Carolinians deserve a leader who will fight to lower costs for our families, not for billionaires and corporations. There's only one candidate who will do that, and that is why it's so important that we re-elect Joe Biden as president in 2024.
Good morning, everyone. It's wonderful to be here. I want us to just look at the facts. The Affordable Care Act 14 years ago made a promise to our country and to North Carolina that more people would be covered, that insurance would be more affordable, and that insurance would be more fair. And now we can report that the ACA on every measure has delivered. That for this year we have over 1 million people that have health insurance only because of healthcare.gov and getting insurance on the exchange. People like my own parents here in North Carolina who never had insurance in their lives until they were able to get it through healthcare.gov. Folks like North Carolinians all across our state who worried every single day about how they could stay healthy, how they could take care of their kids and their family members without health insurance. Health insurance on healthcare.gov gave them access to health insurance at low and many no cost. It gave them good benefits, able to see a doctor, to get prescriptions filled, and it gave them peace of mind. And now, because of the leadership of Roy Cooper and working all across this state, advocates have risen up to say we have got to expand Medicaid, which is, again, only available to us because of the Affordable Care Act. That brings another 600,000 North Carolinians into the fold of being able to have the peace of mind of having comprehensive health care. But it's more than just the 1.6 million North Carolinians who solely rely on the ACA for access to insurance. It's the fact that people with insurance from their employers don't have to worry about pre-existing conditions. It's hard to remember because it was so long ago. But when people would change jobs, they could lose coverage for diabetes, or they could lose coverage for other chronic conditions because of pre-existing condition exclusions. Now, when children past the age of 18 or 21, they can stay on their parents' insurance until they're 26. That is only because of the Affordable Care Act. And now, because of the Affordable Care Act, people can have access to preventative services at no cost. This is such a relief for every single North Carolinian. And folks, without it, the cost will skyrocket. Not just for people to have coverage for buying it on the marketplace, but the impact in local communities. Because we know firsthand what happens when people don't have insurance. They end up sick, they end up in the emergency department, and those costs are borne by all of us. Or they end up worse in jail, or even worse, dead. The ACA saves lives in North Carolina every day, and President Biden has demonstrated his commitment not just to secure and keep the ACA here for the future, but to make it better, to make permanent subsidies that have kept the cost of health insurance down in North Carolina for all of us. Folks, we have got to go forwards. We cannot go backwards. The facts are clear. The ACA is saving lives, and every day we have got to keep President Biden to protect the ACA.
Good afternoon. My name is Shaquita Peacock. I'm a family nurse practitioner and have been here in North Carolina working as a family nurse practitioner for over 25 years. And I know firsthand how the Affordable Care Act has changed and saved the lives of many of my patients. That's why I feel it's so important to speak up about what's at stake this election. There are many stories I could tell on how protecting the Affordable Care Act is important, but there's one in particular that stands out. One of my patients had her hours reduced with her employer, leading her to lose her health insurance as no longer being a full-time employee. Without the insurance, she had to forego her regular preventative screenings like pap smears, mammograms, and colonoscopies. Then she got access to health insurance through the Affordable Care Act, and it was critical that she did. It meant that she was able to see her health care provider for as little as $5 in her copay. She came in for one of those routine screenings, and it was discovered that she had breast cancer and required a mastectomy. Luckily, the oncologists were able to treat it, and she's okay today. I shudder to think what would happen if she didn't have the Affordable Care Act. And that makes me wonder what we're facing again here today, that we can lose that she could lose that. So many of my patients have stories like this, and it reminds me why the Affordable Care Act is so critical for North Carolinians. By repeatedly threatening the Affordable Care Act, health care for millions of North Carolinians are in jeopardy. Without the Affordable Care Act, it would put all of the progress the state has made in providing quality care and affordable access to health care. And we can't afford that. President Biden has continued to build the Affordable Care Act and has made affordable health care accessible to many of my patients. I trust President Biden to continue to fight for my patients and all of North Carolinians to have full access to affordable health care that they deserve. Thank you.
Good morning. My name is Cassandra Brooks, and I'm a small business owner in Wake County. I operate a child care center, two five-star child care centers, and I'm deeply concerned about the threat of, if you will, going backwards in our health care and the threat that the Trump campaign has demonstrated. As a child care owner, I work with families and children and teachers, and they become like family. We are committed to caring for North Carolina children and our early childhood educators, and we go above and beyond to provide the care. So this issue is very personal to me. Being that I, like my colleague here, I have many stories, and they're just not stories, they are real. I had a teacher who did not have access to health care. She could not afford the Affordable Care Act at that time, and unfortunately, she passed away from a preventable condition, Ms. Brenda. She passed away from something that could have been treated with just a simple doctor visit. I'm so thankful that we have expanded Medicaid and move forward through the help of President Biden and his support to the Affordable Care Act. Many North Carolinians and child care teachers now have access to health care. We have been able to expand health care, to Medicaid expansion, if you will, to over 600,000 North Carolinians, and I'm so thankful for that. But unfortunately, we can see what can happen If we move backwards and if we look back and we let the Trump campaign move forward, we will have teachers like Miss Brenda who may not make it, and that's not okay. So we need to make a choice. We need to stand up because that's not okay as a small business owner. I need to ensure that I have healthy workers who have access to health care. And I need to ensure that my families, the parents, have access to health care as well. And so that's why I'm speaking out today and encouraging all to ensure that we do not look backwards, that we move forward in ensuring that all have access to health care. So, long story short, of course, we need access to health care. Of course, we need healthy workers as a small business owner. I thank you today for your time.
We wanted to provide a visual representation of what can happen if Trump took health care apart piece by piece in North Carolina. Cassandra, you mentioned child care workers, people who work with seniors. A lot of these people who are at that wage situation are now getting coverage with Medicaid expansion and under the Affordable Care Act who weren't able to get it before. So it's just so important. These workers who help the very young and the very old, and we know how hard those jobs are, they deserve health insurance. So all of us will be available for questions if you guys are ready to roll.
We'll go ahead and start with Michael Highland.
Back when Medicaid expansion passed, the prospect of this was something we asked Senator Berger about at the time, and he made the argument essentially that, since it passed, we've had all these iterations of a mix of Republican and Democratic control of the White House and Congress, full Republican control, full Democratic control, and it hasn't gone away. Why do you believe things would be different this time?
Because Donald Trump is back. And Donald Trump came within one vote of repealing the Affordable Care Act. Many of you all remember Senator McCain coming and giving the thumbs down. And he is now on the campaign trail saying that he's going to do this again. This is one of the few promises that Donald Trump actually tried to keep as president. We need to believe him when he says this. It's also pretty clear that he takes the side of Big Pharma and the insurance companies. And these efforts that President Biden is making to try to control costs, it's been a big fight. To lower the cost of insulin and to put a cap on what seniors have to pay. And it's a very tenuous gain that he's made here. So we just can't go backward, as Secretary Kinsley said.
Mia. Cardinal Pine.
I was wondering if you could discuss the impact that repealing the ACA would have on the state's rural communities specifically.
On what
The
community?
state's rural communities.
Oh, rural communities would be hit hard. And I'm going to let Secretary Kinsley step up here in a minute. But we're seeing per capita in signing up for Medicaid expansion more rural residents than urban residents. Our rural population has gone without health insurance for a long time, and this is one of the reasons why Republican county commissioners across North Carolina began to come to the General Assembly and say Medicaid expansion is a way to make sure that we get folks covered. Secretary Kinsley, would you want to address that as well?
Medicaid expansion is a real shot in the arm for rural North Carolina. North Carolina has the second largest rural population in the country. And we don't have to look back that far to remember what happens when you don't have health coverage. We've had nearly a dozen rural hospitals close over the last decade. And that's because hospitals and other providers are businesses. And disproportionately, we've had a large number of uninsured folks in rural North Carolina. Medicaid expansion is changing that. We're seeing folks get enrolled faster in rural communities than anywhere else in the state. The leading county in North Carolina is Robeson County with signups. It's amazing to see how they're getting access to coverage, and we know that's going to bring providers back to rural North Carolina, and we can't go backwards.
And if I could just to step in on that, I think one of the things that is not talked about is something that I've had a chance to experience myself, and it was about 4 years ago. I now represent part of Randolph County. At the time, I was representing Chatham and Durham, and one of the things that happened is that the General Assembly had to step in to try to save Randolph's hospital. And I don't think we talk enough about what happens when rural hospitals close down, because rural hospitals are always working at a deficit because they are treating people and doing things for people that are not, quote unquote, profitable for the entity. So when that hospital is not getting reimbursed and when they don't have something like Medicaid to help fill in those gaps, at some point in time they close down. And so with Randolph, we were lucky that they had good representation at the time and was able to get that through. But imagine if the General Assembly had to do that for all of our rural hospitals. And think about what that access means. If you've ever seen anybody in an emergency, the difference in 30 minutes makes a difference, an hour, 2 hours. So when you have people that suddenly their ambulance ride gets extended further and further out because they don't have a hospital near them, that is a huge deal. So we talk a lot about the personal effect on people not having that, but the effect on a community of not having access to a hospital is something you cannot quantitate. So that is one of the other effects. Thank you.
Laura, did you?
Let me add one more thing to that. The irony of this is that for years, Republican leadership in the legislature coming from rural counties were largely responsible in stopping Medicaid expansion. It turns out that their constituents are getting helped the most by it. So it's good that we finally came in with this bipartisan effort. And let's not forget that President Biden is largely responsible for us being able to get the $1.6 billion signing bonus for actually expanding Medicaid, which helped a lot in getting it over the finish line.
Laura?
Sure, this is not about Medicaid, sorry, but we've had in the news around the country, first we had the Connecticut talking about trying to get our businesses in case Mark Robinson becomes governor. And then CNN last night was featuring our candidate, Michelle Morrow. Do you worry about what this election could mean for North Carolina's reputation nationally?
It could erase the gains that we have made. North Carolina, I think, as we walk through the rubble of the bathroom bill battlefield, businesses having left here, when I got elected and came into office, we worked on turning around that image we had across the world that really didn't reflect who we were as North Carolinians. And I think we have now succeeded in showing the country and the world that North Carolina is a welcoming place. I was just at a tourism conference the other day talking about how this has been so important. But it's clear that Republicans have nominated a slew of candidates who want to throw us right back into the culture wars. So when you have the North Carolina Chamber of Commerce saying that they're concerned about it, then you know we have a real problem, not only with the issues themselves, but with what it could do to our economy. And Donald Trump is right on top of that, driving the train on this. And a lot of these candidates have pledged support to him. He's pledged support to them. This is what we have to stop this November.
And if I could answer that also, Laura, because of the fact, I think one of the things that's underreported in North Carolina, we have the most powerful legislature in the entire country, as far as that, when we don't have co-equal branches of government. So the reason that's problematic is one of the things that I see with the candidate for state superintendent that is underreported about what she talked about is she said, we can get rid of the State Board of Education because I will work with the Republican legislature and with their leaders to make determinations about what policy should be. The reason that's significant is because, one, it is again talking about the consolidation of power. Two, as we've made everything more partisan, what's happened is statewide candidates. She should be the arbiter of what happens with the Board of Education or with Education in North Carolina. She's already pledging allegiance to the legislature, which is already, of course, pledged allegiance, as you see with many of the leaders, to former President Trump. And you've seen that with former President Trump not even being in office, the effect that he's had on Congress. And the scary part for a lot of us is if you have a leadership that is hampered by the fact that somebody outside of that leadership or somebody who has devoted themselves to culture wars and things of that sort is making policy for you, even if you have the best leaders in the world with the best intentions. We saw what happened with Speaker McCarthy. I mean, there will be a coup. And if you look at what our legislature is going to look like going into next year, already with the way our districts are gerrymandered, we already know that the largest segment of our majority caucus is going to be the Freedom Caucus. And again, this isn't about whether you do or you don't believe in what it is that they're pushing, but they tend to be more concerned with the culture than they do about policy. And when companies see this, what they see is the same thing that happened at the United States level. They see a legislature that even if that person doesn't end up being speaker, the leader of that caucus, he's able to hold that caucus hostage. And if they're held hostage and your statewide candidates, like Lieutenant Governor Robinson, like the candidate for state superintendent, if all of them are already pledging allegiance to that leadership, which is now hampered by a caucus within their caucus, then you're talking about policies that companies have already said, we're not here for that. We want a place not just that's welcoming like the governor has talked about, we want a place that makes sense for business. How do you have a place that makes sense for business if your government can't think of things that help the greater majority of your people, and it's focused more on telling people how to act? And that is what is so frightening for a lot of us, because there are a lot of presumptions made about what the leadership in the General Assembly is going to look like next year. And again, I repeat, that is not acknowledging what has happened at the national level. So that is a problem that we have.
We'll do one more question.
Just as one example, the Republican nominee for superintendent of public instruction, the person who wants to lead our schools, believes teachers should be able to have guns in the classroom.
She also called for your execution for treason.
Well, that's a serious problem, and I think that shows what kind of leader that we're talking about here.
Yeah. Yeah, just kind of going off of everything you're talking about, how real this threat is that the ACA could go away, and if that does, and worst comes to worst, what can we do here locally, state government, as business owners, as healthcare providers, to still try and protect our vulnerable
Well,
citizens?
that's going to be very difficult, because we're talking about billions of dollars here. And when you look at how long President Biden, then as Vice President, and President Obama, and people worked to put together the Affordable Care Act, how difficult it was to get through. The problem with Donald Trump and the Republicans is that they have no serious alternative here. They just want to destroy what's here because they don't like it. And the problem is, I think everybody has an idea of how they'd like to see health insurance. We're the richest country in the world. We ought to figure out a way to make sure that everybody has health care coverage, but we aren't there yet, and people have different ideas. But I'm not sure that we don't have the ability to replace it. And there will be millions of North Carolinians who will be worse off with their health care if Donald Trump is elected president.
All right, thanks.
And in fact, you said, and I'm sorry about continuing to jump in, I just think there are points that continue not to be reported on. I would say that the governor is being kind, because that falls right on private citizens and right on private companies. And again, gets back to Laura's original question about the effect that it has on businesses. Suddenly, businesses have that burden again, and they're going to pay in one of two ways. One, they're going to have to get health insurance themselves for their employees, who we should be providing insurance for through the ACA. Two, if they do not get that insurance, then they lose that in man hours, with people who cannot work, who cannot be there, who cannot take care of their health, who cannot focus on their work when they're at work because of health problems, just like was talked about right here. That goes directly there. And the thing that we don't seem to recognize is those are your tax dollars. We keep acting like in government that this money that we're spending is something that we generated. The 170 people that serve in that General Assembly did not generate this money. We pay taxes, you pay taxes. What we're supposed to be doing is saying, here's the best bang for your buck with your tax money. And so when you do something that does not benefit most people, and it only benefits a few, because if you look at the way we spend in that budget, there's a lot of that money that is just going to no bid contracts and things of that sort. So that's going to continue. And so then these people aren't covered with health care. And so as we continue to make bad policy in these type of areas, private businesses, private citizens, counties, cities, councils are all the ones that bear the brunt and bear the expense, when that's something that we are not only supposed to be helping to cover, but that's our job. So that's who's going to bear that brunt if there's a change in the national political picture, and then all of that money gets pushed down to us. Don't think that we're not going to pay for it. It's just a question of who pays for it. And there is a general belief right now in the General Assembly that those that are in the wealthiest positions should not have to pay for anything that serves people who are working every single solitary day, and that's wrong.
Thanks, guys.
I just want to add, as an educator, a business owner, it saddens me about Michelle Morrow. We work with all families. We work with all children, children with special needs, unique needs, just different things. And she referred to a child as retarded. And I saw that video on TikTok, and it saddens me that that person is running for state superintendent. We cannot go backwards. We are moving forward to try to help all children and families. That children with special needs, they do need more health care. Their family needs access to more health care. And if we allow her to get elected, we will really be stepping not 1, 2, 3+ steps backwards, and we must not do that. So I just want to thank Governor Cooper and all for pushing to have Medicaid expanded and the Affordable Care Act and President Biden. So let's just move forward. I agree with, as a small business owner, we need our employees healthy. Of course, like I said everywhere, of course, small business owners need employees. We need them to come to work, and we need them to be healthy, and we need them to be productive. So let's move forward. Let's not go towards the Trump campaign, but let's fully support the Biden campaign in North Carolina. Thank you.
All right, thank you, everyone. We appreciate it.
Thank you for reaching out.
Which is an insane thing I have to say. Anyways.
Thank you.